Hello everyone, and I hope everybody is doing perfectly fine. So today I'll be discussing a tale of two cases wherein a normal fungal infection, it mimicked a soft tissue lesion in the patient. So I'll be dealing with two cases, case one and two. Both were found to have Candida infection. Then just see the location where we found this fungal infection. So case one to begin with, she was a 48-year female who presented to a hospital with swelling in the left lower temporal region for the last 2 months. And this swelling was slowly progressive and was non-tender. In patient, there was no history of diabetes, hypertension, TB, or any kind of significant medical or surgical past history. On examination, what we found was the swelling was approximately 1 into 1 centimeter. I'll show you the picture. And it was firm, non-tender, and mobile. And clinical diagnosis. So the clinical diagnosis here given was a soft tissue mass, which could be neurofibroma based on the location or schwannoma. So a diagnosis of peripheral nerve sheath tumor was considered in this case. So patient was advised for the routine blood investigation and final aspiration cytology. So blood investigation like the complete blood count, the biochemical parameters like blood sugar levels, LFT, KFT, thyroid profile, they were all within the normal range. And when we did the FNA from the swelling, the aspirate was blood mixed and the smears were stained with Giemsa and Papanicolou stain. On cytological examination, what we reviewed was extensive necrosis and also noted were numerous pseudohyphae and spores and budding yeast form of Candida, that is a fungal infection. And we applied special stain, that is paradic stain, paradic acid Schiff, and gram stain. So which also showed just to confirm the presence of the fungal elements. A repeat aspiration was done and KOH mount was also done. KOH mount, we do it for fungal stain. I'll show you the picture as well. So here you see, in figure what we are seeing is, this is the swelling which the patient had, the left temporal region में था, and this is the Giemsa stain smear. Here you can see this is the pseudohyphae and budding forms of Candida infection. And this here you can see the pseudohyphae, these are located on, we can see on KOH mount. So similarly, case 2, the special stain images I'll show you in case 2. So case 2, similar case of fungal infection we noted in a 10-year-old male child who presented with swelling in the right lower neck region of for last 6 months. And there was history of off and on cough and fever, fever. There was no cough or any respiratory illness in the past. No systemic or significant intervention was done. So on examination, what we found was the swelling was soft and fluctuant with stretched overlying skin. So this is pus and it is going to burst open. It was just similar to that with very thin peppery skin it was there above the swelling. Clinical suspicion of TB was made based on the location of the swelling, age of the child, history of fever was there. So FNA routine investigation and psychological evaluation was advised to rule out tuberculosis. Complete blood count, routine biochemical investigations were all within normal limit. And what we found on FNA, it yielded whitish flake-like material. And we saw numerous spore fungal hyphae along with budding forms. KOH mount also was done in this case with Grab stain and pass, which showed presence of Candida species. We did culture also on blood agar, which showed the round pasty yellow colonies filamenting along the outer border, and this confirmed the presence of Candida species. This we had sent the sample in microbiology department. From there, the culture on the blood agar confirmed the presence of Candida. The smears were prepared, and what we did from the culture, the growth which took place, उस growth से हमने smear बनाया, and in that also we noted budding yeast form and spores, confirming the presence of Candida species. So here you see, this is the swelling in the right lower neck, the 10-year-old male child. It was 4 into 4 centimeter cystic swelling, and the overlying skin was stretched out and like light reddish. And then what we got on here, you can see this is the Giemsa stain. यहाँ पे भी आप देख रहे हो pseudo hyphae is there. with budding forms. And this was the gram stain. This is the gram stain image. यहाँ पे भी आप देख रहे हो spores देख रहे हो, the round one and the hyphae, fungal hyphae you are seeing. So these are all gram stain. So this special stain is mandatory to do to confirm this. If we can, it is very like obvious in Jitsa also, but to confirm what we do is we use special stains like poradic acid shift. We use gram stain, GMS stain also it is used. So many stains are there which will highlight the organism. So to just to reconfirm, we need to do this special stains. So these two cases is showing what? That is the Candida infection jo hota hai, you can see in different locations. So these two were very unusual location where we can see Candida. So it can like take a form of invasive candidiasis. So you have to like identify these organisms correctly and timely so that appropriate treatment can be given to the patient. So these two were unusual locations, the temporal region and the right lower neck for Candida species. So this is the culture image. Blood culture, हमने blood agar पे culture करवाया था. So these pasty colonies you can see here also, and here this is the colonies. So what we did, इससे हमने smear बनाए the culture plate से. So here also you can see spores. The round one are the spores. The छोटे rounds, round. These are the spore, and these are the hyphae. Okay. Here also you can see. This is also a similar image. Hyphae and spores are seen. So these smears were made from the growth which took place on the blood agar plate. So just to remember, so this few points I have highlighted. That primary cutaneous mycosis, it is an uncommon entity. Usually notice what we see, the important thing was in both of our patients were immunocompetent. Immunocompromised अगर patient होता है, like diabetes है, on chemotherapy or cancer patients or on immunosuppressive therapy patients अगर होते हैं. So in those patients, you can see some kind of fungal infection. So but this in immunocompetent patient, it is rare to find. And mode of entry is direct inoculation of the fungus into the skin or from any trauma like burn or IV cannulation through which the fungus gets entry to our body. So Candida species जो होती है, infection can be three ways. या तो वो superficial हो सकता है, cutaneous हो सकता है, subcutaneous, and deep systemic infection, that is known as invasive candidiasis. And invasive candidiasis, it is seen in 25,000 individuals every year with a high mortality of 40%. Making it a potential life-threatening condition. So see, with just a simple test, FNAC, we could identify these organisms at two unusual locations and preventing the invasiveness of this fungal organism. So this mandates, this data I have put just to highlight how threatening it can be. Like this, but treatment is very simple. So this mandates an early diagnosis of such infections to initiate appropriate treatment. So very few cases have been reported in literature of cutaneous candidiasis. Kotiam et al., they had advocated the use of culture method for subcutaneous abscess for precise diagnosis. So confirmative hota hai culture obviously. And Amita et al. And Kotiam et al. In 2000 and Gochat et al. In 2017, 15 and 15 respectively, they reported cutaneous candidial infection in the right forearm. These are the different regions where I'm giving the example of the reported literature. किसी ने right forearm में report किया है, कुछ ने chest wall में report किया है, and forehead respectively. And what we report is 2 cases of candidiasis, one in the temporal region and other on the right lower neck region, both in immunocompetent. So this makes this case much more rarer. So role of FNAC, see how it is important, how we delayed the if we delay the diagnosis of such fungal infection, it can lead to serious, grave consequences. So along with routine, this I have told you, that along with the routine HG and the PAP stain, special stain like poradic acid shift, KOH mount, हम fungus के लिए करते हैं, culture, then there's all stains and gram stains. So these are important to highlight these organisms. So culture is obviously the gold standard, but what a deficit with culture is that it requires a lengthy period, approximately 2 weeks चाहिए इसको grow करने के लिए और categorize करने के लिए. So to add to it, serological जो reactions हम use करते हैं, serology अगर करेंगे तो वो react complete specificity lack करती है, positive rate being only 50%. So cytology, if we can use special stains appropriately, So that will be a major role in being simple, widely available, fast, easy, and cost-effective investigative modality in its diagnosis. So to conclude, so there's all superficial वो suppurative soft tissue lesions होते हैं. So should be judiciously screening करनी बहुत जरूरी है to find the presence of this infectious agents. So primary mycosis, as I said, it is rare but easily treatable. तो अगर हम antifungal शुरू कर दें for candidiasis, so patient can recover very fast. But if you don't diagnose properly and you wait for a long period, so this can acquire an invasive nature. So deep mycosis infection हो सकती है patients. So FNA in conjunction with special stains like PAS, POH mount, and obviously serology like culture and all, everything we can do. But cyto FNAC with special stain can give you early diagnosis in managing these cutaneous mycosis and preventing this unwanted, dreaded complication of a simple infection which can be prevented to acquire a very heavy complication or grave before going into a grave consequences. We can prevent this infection to flare up. Right? So thank you so much. These are few of my references which I have used. So thank you so much for your patient hearing. Kindly like, subscribe and share my channel. Thank you so much.